Health begins at home. For women and children to survive and thrive, communities themselves must provide energy, leadership, and be champions for MamaToto package success. Where the MamaToto package has been implemented, communities are primarily rural, with often limited access to formal health facilities. Practices impacting health for women and children must begin in villages. The MamaToto package engages and trains volunteer community health workers called Village Health Team members, or VHTs. From each village, they serve as health champions. Communities themselves select VHT volunteers who are trained on immunization, nutrition, and how to prevent illness at home. Training is participatory and provided by local health workers. VHTs learn to assess and manage sick children and pregnant women with danger signs. VHTs visit homes to encourage healthy eating practices, check on newborns and new mothers, assess and refer sick children, and give health presentations. VHTs encourage better sanitation practices around homes, including promoting tippy taps for hand washing, clean latrines, waste disposal, and dish drying racks.
I'm happy to be a VHT because I've benefited and my community has benefited. For example, even when it is during the night and someone gets ill, I write them a referral note, and even though the health center has closed, but the health workers who stay around are able to help them simply because they got a note from the VHT. And personally, as a VHT, I'm very happy because people respect me as the health worker at the village.
VHTs coordinate health-related activities within their communities. Income-generating programs like this poultry project provide assistance in the long-term sustainability of the volunteer program. This one helps 21 families to help themselves. Other examples of income-generating programs are goat-rearing collectives, bee and honey production, and craft creation and sales. Village health teams meet regularly with healthcare staff and report on the health of children and of pregnant women in their communities.
It is a great change. Not only a slight, but a very great improvement has been shown, depending even on how the statistics were at the beginning and how they are now. There is a great change.
As champions of health, VHTs can prevent illness before it happens and are a first line when problems do arise, armed with some basic tools, energy, and knowledge.
Our children are no longer getting sick like they used to get sick because now they know that they have to get immunized for polio and other immunizable diseases, but also most especially when we have programs for children to go for deworming and for vitamin A, the communities really take it up. And they sleep in bed nets. I had one of my children used to have a big stomach, and I was told it was because of the worms. So when they brought the medicines, the drugs, I've seen the size of the stomach has reduced and he's able to eat well, better than before.
So my view of Health Child Uganda, it has come up with local made solutions.
Dr. Paul Kagwa is the National VHT Coordinator with the Ugandan Ministry of Health. He has had the opportunity to see the MamaToto program in action.
The principles can be applied in any part of Uganda and maybe in any part of Africa. So it's basically the principles, how you approach the community, how you seek their input in terms of identifying problems, identifying solutions, and coming up with a clear roadmap on how to address those problems using the strategies that have come from people. Ours is to facilitate. And the community comes up with the ideas. And that's what the community will take up seriously. Because it's theirs. It has come from them. It's not foreign.
VHTs are core to MamaToto package success. They reach the most vulnerable and with tools can truly prevent deaths and save lives, improving health for current and future generations.